Good morning, everyone. I would like to share you my progress on my PhD topic, Novel Approaches in the Management of Hidradenitis Suppurativa. My name is Koorosh Karimi. I'm a medical doctor and full-time PhD student at the Department of Dermatology, Venereology, and Dermato-Oncology at Semmelweis University. My journey into research was driven by a strong desire to make a meaningful impact on the life of patients suffering from chronic dermatological diseases. And among those, Hidradenitis Suppurativa stood out as an area with a significant unmet needs. Therefore, our vision is to improve the quality of life of patients suffering from Hidradenitis Suppurativa, and in order to reach that vision, my mission is to identify the best surgical techniques for Hidradenitis Suppurativa. Currently, we launched 2 projects in the last fall, both of them in the topic of surgical management of Hidradenitis Suppurativa. In my first project, we are investigating the safety and efficacy of surgical techniques in Hidradenitis Suppurativa patients through systematic review and meta-analysis. Hidradenitis Suppurativa is a chronic progressive inflammatory skin disease characterized by abscesses, nodules, and fistulas, and it could often lead to irreversible structural damage. It has a severe debilitating effect on quality of life of patients, with over 77% of the patients reporting severe pain and 51% of patients are suffering from depression. The prevalence of the disease is estimated between 1 to 4% in Europe. This means with over 8 billion population of the world, up to 300 million people could suffer from this disease worldwide. There are various scaling systems for HS, however, the most widely one for surgical assessment is early stage. Once there is irreversible structural damage in the presence of active inflammation, surgery is the only definitive treatment. There are various surgical methods for HS, and these are ranging from incision and drainage, steep, wide excision, or deroofing. However, there is a high postoperative recurrence and complication rates, with 30% of patients suffering from recurrence and 18% of the patients reporting complication after the surgery. And the challenge is, yet there is no consensus on the effective surgical approach. Therefore, our aim is to investigate the postoperative recurrence and complication rates in Hidradenitis Suppurativa patients to identify the optimal surgical approach. Our clinical question is, which surgical method is associated with the lowest recurrence and complication rates in HS patients with different stages? For this, we use the PICO framework, where population P1, P2, and P3 are patients with mild, moderate, and severe HS, and our intervention and comparison would be different surgical methods for HS, such as wide excision, deroofing, and steep. And the primary outcome are recurrence and complication rates. Our hypothesis is the wide excision with the secondary intention healing is associated with the lowest recurrence rates in patients with Hidradenitis Suppurativa. If our hypothesis is true, improved surgical outcome in Hidradenitis Suppurativa is the clinical implication of this research. We conducted the search key in 3 databases with 2 domains. The first domain consists of Hidradenitis Suppurativa and its synonyms, and the second domain consists of different surgical methods for HS. After the search, our search resulted in 5,500 hits, and after the full text and title and abstract selection, we had nearly 127 articles. And thanks to citation chasing, which is quite new, we could find another 10 articles which we haven't found before. Currently, we are at the data extraction, and we are hoping to move forward with the risk of bias and tables soon. In my second project, we are evaluating the efficacy and safety of perioperative use of biologics in Hidradenitis Suppurativa through international survey. Hidradenitis Suppurativa remains a challenging disease to treat, especially at stage 2 and 3 of the disease, where surgery is often required in addition to other systematic treatments. There is a wide range of treatment options available for HS. These are ranging from biologics to different surgical methods. However, the choice and the preference of the choice and sequence of the treatment is heavily reliant on physician preferences, as the guideline lacks clear directives on optimal approach. Therefore, currently, guidelines suggest that before the surgery we have to reduce the inflammations. We could often achieve this with the use of biologics. However, it's not clear whether we have to pause them before the surgery or continue it after the surgery, or should we give them medication both before and after the surgery. Therefore, our aim is to investigate the impact of perioperative use of biologics in hidradenitis suppurativa patients. Our clinical question is, does the use of biologics decrease the healing time in hidradenitis suppurativa patients? For this, we use the PICO framework, where population are surgical candidate HS patients with early stage 2 and 3. The intervention are biologics, such as secukinumab, bimekizumab, or adalimumab, and the comparison are not using biologics, and primary outcomes is healing time, secondary outcome is recurrence and adverse events. Our hypothesis is the use of biologic in hidradenitis suppurativa patients reduce the postoperative healing time. If our hypothesis is true, the clinical implication of this would be reduced postoperative healing time in HS patients. In summary, we are hoping to submit the first project by September 2025 and the second project by November 2026. And I would like to finish my presentation with this quote from Isaac Newton: "What we know is a drop, what we don't know is an ocean." Thank you for your attention, and I'm happy to answer any question you might have.
I would like to ask you if you are planning to do a subgroup analysis in your first project.
Well, yes, we are planning to do subgroup analysis, but we need to check the result first and discuss with our team but mostly probably for different surgical interventions and different population we are making subgroups.
Regarding your first project, I would like to ask if you are planning to investigate other outcomes.
Yes, in the first project we are investigating the healing time, pain score, and quality of life of patients as well.
What are the possible complications of HS?
Thank you very much for your question. So possible complications are bleeding, wound dehiscence, or scar hypertrophy, or keloid scar could often happen. Sometimes when the patient receives flaps, they could get a flap necrosis or skin graft. When they receive it, it could have a graft failure.
I would like to ask you if you have any hints or suggestions, which is the best surgical approach? What do you think?
Well, based on the data that we saw and the preliminary data extraction, we've hypothesized that the secondary intention, wide excision with the use of secondary intention healing is associated with the lowest recurrence rates. However, we also believe in our clinic, especially in the Semmelweis clinic, that the steep is also very good. However, there are not many results available for that, unfortunately.
What might be the reason that steep and wide excision with secondary healing might be more effective compared to, for example, incision and drainage?
So incision and drainage almost have 100% recurrence because they don't treat the cause of the disease. It's a temporary relief for the problems. However, once they do the steep or wide excision, they remove the pathological part or disease area. That's why we think it has a lowest recurrence rate and complication.
What do you think, what type of biologics might have the least side effects in this patient population that we would also like to do surgery on?
Well, I think bimekizumab or secukinumab are very good. They are recently approved by FDA as well, some of them, and then I believe they're very good and effective in treatment.